Well, welcome back to the office. How was your adjustment with the last visit?
That was great.
It was good?
Yeah,
Okay,
it helped
cool.
a lot.
So today we're just going to kind of continue that care so we can build on what we started. So basically what I feel is some tension in the back, so we'll work on that. Let me take that hot pack away. I like to start with the Theragun. So while I have it still warmed up, I can kind of take advantage of the heat and then just kind of get those muscles to relax even more. And the pressure's okay? Is
Yep.
it too strong?
Nope, that feels great.
Cool. So we're just trying to loosen up the muscles, just kind of reverse engineer everything back to its normal behavior, you know. Get rid of all that spasm, that tension. So any questions about chiropractic and pregnancies?
Yeah, are you able to explain how chiropractic care helps with round ligament pain? Because I know that's like the one complaint that a lot of moms have is round ligament pains, and how chiro care could help alleviate that.
Yeah, absolutely. So chiro care, it's not just cracking backs and necks, it's also working on the soft tissue. So any ligament, including the round ligament, can be treated. And the way we treat it is just hands-on manipulation of the soft tissue itself. So the ligament, we press upon it, and that helps get blood flowing into it and gets it to relax. So sometimes there's too much tension, as like right now in your back and muscles. And so I'm just working it out, right? Just touching it, feeling it, putting pressure on it. Same thing with the ligaments. Just touch it, feel it, put pressure on it, and it kind of gets it to just calm down, gets it to relax. And that's how we treat the round ligament. So again, we're not trying to treat anything that's related to the baby itself. That's all through the OBGYNs. We're just treating the mother. And if she happens to have a round ligament, so be it, right? We want to take care of it as much as possible. So when we flip you over on your back, I'll show you how we find it, and then also how we treat it. So, but I didn't realize that. So a lot of mothers have a lot of pain due to the round ligament.
Yeah,
tension.
especially like I feel as you have more and more pregnancies.
Yeah.
Like for me, it feels like it gets tired of like having to be supportive, so it gets tighter.
And that's what we find too. So as you get later onto the trimester of the pregnancies, like the ligament does stiffen up because it is holding a, you know, it's something inside you is growing, getting bigger. You know what I mean? That beautiful baby that's about to be born. And now it's that ligament, there's just more tension on it. So that does make sense, yeah. Okay. And I love this table because you can't really lay down on your stomach when you're pregnant. It's a little difficult, you got a big belly in the way. So this is a great way to just open it up and make room and give you a chance to take a break.
Yeah, it feels so good.
Even for like 5 or 10 minutes.
Yeah.
You know?
Definitely makes
Awesome.
a difference.
Thank you.
It helps take the pressure off like my back and my hips because you can only lay down on your back or your side.
Yeah.
So to be able to lay on my belly for a little bit does help a lot.
Cool. So let me grab some lotion real quick from the other room and I'll be right back.
Okay.
Just a second. There we go. Okay.
You said that has arnica in it?
Yeah. Yeah, it's called Biotone lotion. It's one of my favorite. And it's a mixture of lotion and oil. So if it's just massage lotion, it kind of absorbs in the skin a little bit quicker than I want it to. And if it's just oil, it just, you know, we'll be here for a long time because it just never goes away kind of thing. But this one, it gives me enough like slipperiness as I'm working you out where it doesn't dry up too soon. And I can just work it out, yeah. And the arnica is just, you know, there for some good luck, I guess you could say so.
Arnica is awesome.
Thanks. But it's hypoallergenic, that's why I like it. And it doesn't like absorb in the skin so quickly that I can't, like I gotta keep squirting it on my hand and keep putting it on you again and again. I'll be here all day doing that too.
Is that something that can be bought over can anyone get that? Or is that only?
Yeah, it's on Amazon. Amazon's where most of these things are purchased nowadays. And, but yeah, so the brand is Biotone. And it's
awesome. I might have to get
pretty good stuff, yeah.
especially for the kids. They're always complaining they're hurting. I'm like, you're fine.
Yeah, I learned some of my soft tissue technique from my mentor, Dr. Horgan. He's such a great guy, and he's pretty straightforward with how things work. Very scientific. He can figure out a diagnosis, just putting it together, just like. So he's the one that taught us soft tissue technique, and he's the one that uses that lotion. So I just figured if it's good enough for him, it's good enough for me. So.
That's awesome. Are you able to feel the relaxin kick in?
Oh, yeah.
When you do treatment on pregnant women?
That's a great question. Yeah, so I do notice that. So patients come in that are pregnant and they're like, my hips are moving, my pelvic is out of alignment. Why is that? I'm not doing anything. I'm just at home. And part of it is that relaxin, hormone kicks in. And then you start to feel the muscles relax, like the joints start to open up and spread out a little bit. And it's doing that on purpose because it's getting ready to have a baby. Your joints need to be flexible, need to be loosened up. But then that can also cause pain and discomfort. So in that situation, getting an adjustment is even more important because the purpose of the adjustment is to put things back in alignment. And if your body's loosening itself up to have a baby, things are going to kind of fall out of alignment. And then always, we always want to combine our adjustments with some form of exercise to hold things in place. So not only do we put it back together, but your body also holds it there. Okay, so let's go ahead and do some adjusting in this position here. Breathe in and out. That's it. Very gentle. Good job. Okay, we'll get a little bit more up here. Excellent. That was pretty good.